Julie Johnson is also going to come up and share a healthcare story here. While she's coming up, I'm going to say we have some time farther down in the program for additional folks who we didn't set up ahead of time to share their healthcare stories. So Jill Lynch here in the Santa Claus kind of hat. If you have a healthcare story that you'd like to share before we leave here, come and talk to her, and we'll see how many of those we can get in, because this is about people. This is about people who need help and who need coverage. What is it, 33 million? 40, how many are we not covering?
46.
46 million people. 46 million people without coverage.
Children.
That's what we're here doing.
Children.
Please welcome Julie Johnson.
Hi. I'm here to tell you Shane's story. Shane is my son, and when he was 15 years old, he discovered a lump under his arm.
A little bit louder.
Oh, okay. Feels like I'm yelling.
Yeah.
Okay. So my son Shane, when he was 15 years old, he discovered a lump under his arm. And yes, it was cancer. We went through all the protocol treatment and the talking and the tests, and he went through his first, made it through about his first year, and he was in remission. So we went and did the follow-up treatment, and turns out that he had relapsed about a year later, just after graduation. So they gave him a new drug, asked him if he would like to try it, and he said yes. And it, again, brought him into remission. However, we knew then that we would need to have a transplant because it wasn't working, it wasn't staying. So, turns out that the insurance I've had for at least 20 years would not, okay, we knew we needed the transplant, and it turns out that the insurance would not cover the search for a donor. They would cover the transplant. However, you cannot have a transplant if you don't have a donor. So then we went into panic mode. What do? We talked to other people who had sold their houses and gone bankrupt, and their insurance had run out, and all kinds of things. So I knew it was around there, and the doctors had kind of given me a heads up. Well, it was suggested that we try Medicare, so that's what we did. Thank God Medicare was there, because they would cover the search for the donor. That was $3,000 just to get on the list, and $1,500 for the first 5 people. On Medicare, they found a donor, which was a real close match. And then it turns out that my insurance company said, you know, since he's been sick and he can't go through a full bone marrow transplant, we're giving him a stem cell transplant instead, which is more adult versus the babies. So they said, well, shoot, we're not going to cover that either, because that's too new. It's not proven that it works. Of course, nothing is ever proven that it works. So you're kind of going with the flow anyway. So I wanted to let everybody know that without the Medicare, he would have died then. People suffer. Anyone who's ever had a relative or a child or a parent or anybody they love that goes through this knows that there's enough stuff to take care of and worry about. You learn how to give medication. You drive back and forth. We drove up to Redmond every day. I came back and I worked, and I drove up there and spent the night, and then I left in the morning and came back down. So, and you've got bills. We had to move up to Seattle for 3 months. So there's a lot of money involved. And the big thing to me is it felt like they were always asking me to put a price on my child's life. And how can you do that? We just can't let people suffer no matter who they are. If we can fix it, we need to fix it. And that's why I'm here. Thank you.